My name is Miranda Gore. I'm from Halls Creek. If we have to have a surgery, we would have to go to Broome or to Perth, but it's about 1 to 2 year wait.
Narelle Catewell, I'm from Geraldton, and I use the Aboriginal Medical Service up there, Grams. I was diagnosed with bowel cancer and I had to travel to Perth for my chemo. I couldn't have my chemo in Geraldton. So for 12 rounds of chemo, every 2 weeks I travelled up and down to Geraldton with the assistance of PATS.
I'm Tracy Lee Chamberlain from Broome, Western Australia. It's not always that easy. Seeing your GP, it is. But if we need to access further treatment for down in Perth, it's not always that easy, trying to liaise with the hospital and PATS.
I'm Meredith Waters and I'm from Esperance in Western Australia. Actually, I think that we are very blessed in our little town. We have a district hospital that is run by fantastic staff and a really good cohort of GPs, but it wasn't always that way. So there's been a lot of work done which we're very grateful for. But having said that, we're very limited in access to specialists. So that is always a little bit tricky, and being 750 kilometres from Perth, which is of the source of lots of specialists, makes life very difficult for lots of people who require that service.
Well, first of all, there's no communication, there's no consultation. You're not included as a patient. I never knew you were, or you could be, or you should be. Yeah, it's not informative and you don't feel you're included in the decision of your treatment, I guess.
I've had a good journey, yeah, and I'm cancer-free, been cancer-free for 3 years. Yeah, combination of bush medicine, chemo and God. So yeah, I've had a really good experience. And in my situation, there is a cancer clinic in Geraldton, but I was diagnosed stage 4 and they just sort of flicked me straight to Perth. And yeah, without that PATS, just wouldn't have been able to do the travel. I had family down here, but it wouldn't have been the same.
Well, first of all, I feel that like there's a barrier between us as First People and the health staff, non-Indigenous. We can improve it by education both ways, to understand both worlds. Just be treated as a human being and included.
In our local area, to improve the communication, improve the services so that it is statewide. I really liked the healing process that we actually have down here, if we can have that up in the Kimberley or statewide.
Thinking about what really matters to a patient or us as we come into the health service, sometimes just having a look at only the physical clinical issue is maybe not enough in terms of a great outcome if what's important to each person is not taken into consideration. So that what matters to me question, or what matters to the patient, is, I think, a change that could continue to improve.
Mainly the personal experience from other people, from the service providers. Like I have seen a lot of country people that might be shy and don't talk up, and I see that they get lost in the system. Whereas if there's more Aboriginal people meeting and greeting them, or even being more culturally sensitive to them, you know, might make them feel more comfortable.
Inclusiveness, communication, so that the communication goes right from the doctor to the hospital that they're wanting to send you to, and through PATS, and communication with the consumer as well.
Personally, when accessing the health services, what is really great is when I'm listened to and respected. I think that's the key to everything, and really knowing that I've been heard and taken seriously is what makes it a really good experience. And also trusting that, of course, that they're going to help.
The information sharing about what other Indigenous people are doing in different areas?
I think it's great. I've heard of a lot of different agencies down here in Perth and what they're doing for Aboriginal people, and we have similar things, you know, in Geraldton, but it is good to hear of other agencies and things.
The inclusiveness, I liked the integration of all the different kinds of services that you actually have down here in the metropolitan area, and I'd really like to see a lot of it actually up in the Kimberley.
Today's event has been fantastic. I think meeting outside for the whole day, I can't remember the last time that I spent a whole day outside and connected with people that I wouldn't have otherwise had an opportunity to meet with, knowing that there's great things happening in the metro area and in the regions, and recognising that we probably don't network well enough together, which is something that's often said, but it's days like today that really makes a difference to that.